Good day, everyone. The topic we choose is all about the revitalized effort to tackle communicable disease.
Recent decades, WHO and partners have worked resolutely to end the scourge of polio, HIV, tuberculosis, and malaria, and to avert epidemics of diseases like measles and yellow fever. COVID-19 set back much of this work in 2020. So in 2021, we will help countries get vaccine for polio and other diseases to the people who miss out during this pandemic. As a part of this push, we will work to improve access to the HPV vaccine as a part of the new global effort to end cervical cancer we launched in 2020. We will work with partners to implement the new 10 years roadmap for neglected tropical diseases in TDs, with its global targets and milestone to prevent, control, and eliminate and eradicate 20 in TDs, as we will intensify efforts to end AIDS, tuberculosis, and malaria, and to the minute viral hepatitis by 2030. The development problem statement is first, what are the most effective way to prevent communicable diseases? Second is what are the actions of the government in terms of preventing communicable diseases?
Have a shared vision. The vision of this is a health promoting globally free of preventable communicable disease, premature death, and avoidable disability. That would be the shared vision of our topic.
This action plan is consistent with the global strategy for the prevention and control of communicable diseases and will continue to drive work that is already bearing fruit in many countries. Nevertheless, there is a need to strengthen efforts on strategic issues and intervention to ensure delivery of the agreed international and regional targets on premature mortality from communicable diseases within the time frames. There is also need to consider new developments in knowledge and policies. The importance for the prevention of communicable diseases should be recognized and emphasized, and the leading cause of the global plan, which requires focusing on population level and targeted approaches to control communicable diseases. Also, achieving the broader vision on avoidable disability, given its leading causes, will require synergies between relevant action plan and strategies and a particular focus on a broader set of risk factors and determinants, as well as early detection and management of the disease.
Verify the relevant information.
Promote vaccination and relevant communicable disease, control to prevent development of communicable disease and order exacerbation, where the context and resources allow. Although commonly referred to as communicable disease, a number of this group of disease originate from and or are exacerbated by an infection or complicate treatment, which has complications for response. There are some shared causal pathways such as undernutrition and poor sanitation, shared risk factors such as tobacco, alcohol, and poverty for communicable disease and tuberculosis, and shared causative agents such as an untreated infections linked to cancers and some communicable disease, for example, streptococcal disease and rheumatic valvular disease. Several conditions communicable can coexist in one person, which has consequences for health management.
So we have here the review and organize the data. So communicable disease. So what is communicable disease? A communicable disease is one that is spread from one person to another through a variety of ways that include contact with blood and bodily fluids. Also, breathing in an airborne virus or by being bitten by an insect. So reporting of cases of communicable disease is important in the planning and evaluation of disease prevention and control programs. So in the assurance of the appropriate medical therapy and in the detection of a common source outbreaks. So law mandates healthcare providers and laboratories to report over 80 diseases or conditions to their local health departments. So some example of the reportable communicable diseases include hepatitis A, B, and C. And we have also here the influenza, measles, and salmonella, and other foodborne illnesses. So how do these communicable diseases spread? So how this diseases spread depends on the specific disease or infection agent. So some ways in which communicable diseases spread are by, first is the physical contact with an infected person, so such as through touch. So we have here the staphylococcus. We have also here the intercourse or the sexual intercourse. We have here the gonorrhea and HIV. We have also the fecal or the oral transmission. We have here the hepatitis A or droplets. We have here the influenza or the TB. So contact with a contaminated surface or object or Norwalk virus. So food, we have here the salmonella and E. coli. So in blood, we have the HIV and hepatitis B. And we have also the water, which is the cholera. So bites from insect or animals capable of transmitting the disease. So we have here the mosquito, which is malaria and dengue or a yellow fever. We have also the what we call the flea plague. And travel through the air such as tuberculosis or TB or measles. So revitalize efforts to tackle communicable disease. In recent decades, World Health Organization and partners have worked resolutely to end the scourge of polio, HIV, TB, and malaria, and to avert epidemics of diseases like measles and yellow fever. COVID-19 set back much of this work in 2020. So in 2021, we will help countries get vaccines for polio and other diseases to the people who missed out during the pandemic. So as part of this push, we will work to improve access to the HPV vaccine, or which is the human papillomavirus vaccines, as a part of the new global effort to end cervical cancer we launched in 2020. So to promote vaccination and relevant communicable disease control to prevent development of CDs and order exacerbation where the context and resources allow. Although communicable diseases, a number of this group of diseases originate from and or are exacerbated by an infection or complicate treatment, which has implication for response. So next is we have here to analyze the data and summarize the findings. So we're going to find the findings to this issue. So this data are focuses on the communicable or transmissible diseases, and also to find a cure of this any types of illnesses, to control spreading any types of viruses in our environment. And also we need to educate our fellow men to know what are the risk factors of poor hygiene and sanitation. So on behalf of our health crisis, our scientists do their best duty to overcome and to end this battle, which is the battle of the health issues. So therefore, some health organizations try their best way to find a cure and also to make a vaccines for prevention in several diseases. So these findings help us to open a new door, especially to the patients who suffer these any kinds of illnesses or diseases, to give them hope, freedom, and also peace of mind to continue and bring back their normal lives. So always remember that prevention is better than the cure. So that would be all, and thank you.